Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today by Commissioner Laura Fortman, the Commissioner of Maine's Department of Labor. We're here today to provide an update on the COVID-19 situation across the state. I'll begin, as we do, with some of the latest numbers. And we again today begin the update on a very sad note. Maine CDC is reporting the passing of 3 additional individuals with COVID-19. One was a man in his 60s from York County. Another was a woman in her 90s from Kennebec County. And the third, a man in his 70s from Cumberland County. During this time of grief, not just for the families, but for everyone who cared for these individuals, we, all of us at the state, extend our deepest condolences to those family members during this time of their grief. Overall, Maine CDC is reporting 965 cases of coronavirus across the state, an increase of 28 cases since yesterday. I'd like to pause for a moment to dive into those numbers for just a bit. Of those 965 cases, 2 are what we refer to as probable cases. Over the past several weeks, the Association of State Epidemiologists, an organization called CSTE, has been working to develop a definition not just of what we have typically reported, which are confirmed cases, but also reports and a definition for what we report as probable cases. A probable case is someone who is very closely linked to a confirmed case. This might, for example, be the spouse of somebody who has a laboratory confirmed diagnosis of COVID-19. If that spouse who lives with the confirmed case, spends a lot of time with the confirmed case, if after 3 to 5 to 7 days were to start developing symptoms and go to the physician, and if the doctor were to say, "I'm not testing you because I believe you to have COVID-19, Maine CDC is now recording and reporting those cases as probable. This is something that we've talked about at these meetings before. And as of right now, of the 965 cases, 2 of them are probable. It is the case that these 2 individuals may go on to get tested, in which case they will then become confirmed cases. But as of right now, pursuant to this definition that was just agreed upon by all of the various states' epidemiologists, we are now reporting and recording probable cases as well. Overall, 152 individuals have been hospitalized at some point during their illness, an increase of 2 since yesterday. Presently in Maine, there are 22 individuals who are hospitalized in regular patient beds with COVID-19 and 17 individuals who are in intensive care units with COVID-19. And presently in Maine, there are 7 people who are on ventilators related to their COVID-19. Overall, 499 have recovered, which is an increase of 14 since yesterday. And 238 of our 965 cases are among healthcare workers. Since beginning our activation, Maine CDC epidemiologists have now fielded 5,456 requests for advice or consultation. I'd like to provide updates on the various outbreaks that we are working with at long-term care and assisted living facilities. At the Augusta Center for Health and Rehabilitation, the number of cases remains the same, 47 residents and 28 staff. However, there was an additional passing there in an individual, bringing the total of number of deaths at that facility now to 4. At Falmouth by the Sea, there are now 9 residents who have tested positive, an increase of 1 since yesterday, and 10 staff, which is the same number as yesterday, for a total number of affected individuals of 19. At the Maine Veterans Home in Scarborough, there have been 30 residents and now 20 staff, an increase of 2 since yesterday, for a total number of individuals affected there of 50. Sadly, there's also 1 additional death, bringing the total number of fatalities there to 11. At the Tall Pines facility in Waldo County, there have been no changes. 31 residents, 11 staff members for a total number of 42 and no additional deaths. At the Cedars facility in Portland, there are now 8 residents, an increase of 1 since yesterday, and 4 staff members, which is the same number, and no individuals have passed for a total of 12. Over the past few days, I've mentioned a developing outbreak at the Edgewood Rehabilitational Center in Farmington. A few days ago, Maine CDC, as soon as we became aware of an outbreak situation, instituted our normal protocol of dispatching PPE, providing technical assistance, and offering universal testing. 78 tests were conducted at the Edgewood Rehabilitation Facility. Overall now, there are 8 residents who have tested positive, which is an increase of 6. There are also 5 staff members who have tested positive. That's an increase of 4, bringing the total number of individuals with COVID-19 affiliated with Edgewood to 13, an increase of 10. Now, again, I'd like to pause and just note that this increase is something that we anticipated. It is a function of the fact that we offered universal testing. And as in public health, as in so many other places, we know that when we go to look for things, we do find them. So this increase of now 10 additional cases of COVID-19 is something that we deliberately set out to find, and having found it, now have a better sense of what's going on and what type of further interventions may be needed there. Overall, at long-term care facilities across the state and assisted living facilities, such as the Cedars, there are 133 residents who have tested positive. That's an increase of 8 since yesterday. 78 staff members, an increase of 6, and sadly 2 additional individuals who have passed for a total of 25. I'd like to now provide some updates on our distribution of personal protective equipment. The first is that today, as well as again on Monday, 14 members of both the Army and Air National Guard have been receiving Train the Trainer testing in order to then go out and provide training and fit testing to healthcare workers across the state. This is something we talked about a few days ago. One of the prerequisites in order for someone to utilize N95 masks is that they have to have undergone this so-called fit testing. This is a process whereby the mask is put on and a headlamp is put on somebody essentially, and a solution is sprayed. If the individual is able to smell that solution, we know that the fit is not good. And they've got to go through the process again and again until we know the mask is tightly fit. Being able to undertake that process and go through it successfully is a prerequisite to being able to use an N95 mask. One of the things that we want to do is expand the number of healthcare workers who have gone through and been certified through this fit testing process. So we've been working with the National Guard of both the Air National Guard and the Army National Guard to train the men and women of the Guard to go out across the state to facilities and train facility members on how to conduct this fit testing. That process began today and will conclude over the weekend and into Monday. Not just focused on fit testing training, but also providing education on how the men and women in the Guard can train other people on donning and doffing of PPE. Again, the goal here is to expand the number of folks who can utilize PPE across the state, especially in affected healthcare facilities. I'd just like to take a moment to thank the men and women of the Guard in general, but in particular, those 14 individuals who have undertaken this mission to deploy across the state to undertake this task of providing additional information on fit testing and proper use of PPE. Yesterday, Maine CDC, working with our colleagues at the National Guard and the Department of Transportation, fulfilled 35 orders for PPE. Overall, over 11,000 pieces of PPE were shipped out predominantly to long-term care facilities, congregant care facilities across the state. Roughly, it was about 1,500 N95 masks, 5,500 surgical masks, about 760 face shields, 3,300 gloves, 360 surgical gowns, and about 125 coveralls. And again, as always, I'd like to thank the Public Health Emergency Preparedness Team, working with our colleagues at MEMA, County Emergency Management, the National Guard, and the Department of Transportation to make these orders and deliveries happen. I'd like to next turn to the latest numbers on the vital resources that we track. At present in Maine, there are a total of 313 intensive care unit beds, 159 of which are available. There are 314 conventional ventilators, 287 of which are available, and now a total of 394 so-called alternative ventilators that are available across the state. Before I turn things over to Commissioner Fortman, I'd like to pause for a moment to talk about a theme that we talked about a week ago, which is grief. In the past 2 days in Maine, there have been 7 individuals who have passed away, who are residents of long-term care facilities, just in the past 2 days. And we mourn the passing of these residents and continue to offer our condolences to the families and to the friends of those who have just lost loved ones. But I'd like to take a moment to recognize and acknowledge and validate the grief that not only the family and friends of these residents are facing, but also the caregivers, the individuals who had been taking care of them at their homes in these long-term care facilities. The passing of these individuals comes at a time when the people that they have cared for and come to know and befriended, and in some cases have done so for years, have now passed away from COVID-19. We recognize the grief that these caregivers working in the homes of our loved ones, whether those are long-term care facilities, assisted living facilities, or others. These caregivers have befriended and cared for these individuals, in some cases for years and years and years. They too are coping with and mourning the passing of their friends. We at the Maine CDC and our colleagues recognize this loss that they are facing. And we've offered our resources, as well as those of our partner agencies, to long-term care facilities in order to provide grief counseling and support, not just for the families, but for the staff who have also cared for these individuals for many years. We acknowledge the loss that they face, and we, all of us collectively, share in the grief of those who are now shouldering that loss. In the past few days, Maine CDC staff have reached out to administrators at long-term care facilities where a high number of individuals have passed. We've provided information on how they can manage the grief of staff members, and even gone a step further, which is to organize a core group of individuals across the state, chaplains, grief counselors, behavioral health specialists, who are able to provide that grief counseling, in some cases remotely, in some cases in group settings, in some cases in individual one-on-one sessions, to any caregiver across the state who themselves is grappling with the grief and the loss of people that they have cared for. At least 6 individual such caregivers, grief counselors and chaplains have volunteered to be part of this force. And of those 6, 2 individuals have volunteered not just to provide services via teleconference, but 2 individuals themselves have volunteered to actually go into facilities where COVID-19 outbreaks are occurring and provide grief counseling and bereavement services to either staff as well as family members. And so I'd like to just take a moment both to acknowledge and validate the loss that caregivers have faced, but also thank the grief counselors and bereavement specialists who have offered their own services. The 6 individuals who have offered to provide these services telephonically, and the 2 individuals who have offered to go into the facilities themselves to make sure that everyone who is coping during this time of grief has support and care. As I've said, and I'd like to repeat, these are difficult times for all of us, and the effects of COVID-19 will continue to ripple across society in different ways. And I'd like to just make sure that we, all of us, acknowledge the grief that's felt in many different ways by many different groups of people across the state. I'd like to turn now things over to Commissioner Fortman. Go ahead, Commissioner.
Thank you, Dr. Shah, for the opportunity to join you this afternoon. As you've already pointed out, COVID-19 has affected every aspect of our lives, and you have been a constant source of reassurance and comfort to many as we're going through these very, very challenging times. I'm painfully aware of the anxiety and frustration that laid-off Maine workers are experiencing. The surge in unemployment claims is historic, and it is beyond anything that any state could have prepared for. And I want to assure Maine people that we are working as quickly as possible to get benefits out and to reassure you that those benefits will be retroactive. Unemployment insurance is a social insurance program that provides temporary part-time wage replacement to individuals who have lost their jobs through no fault of their own. COVID-19's arrival definitely fits that definition. It has impacted tens of thousands of Mainers. It has impacted people across the state, including those working in state government. We all have friends, family, and neighbors who are hurting. Over 100,000 people who were working at the beginning of March have since applied for unemployment insurance benefits. The good news is that 2/3 of those who have applied are now receiving benefits, including the additional $600 weekly benefit authorized by Congress in late March. Over $100 million has been paid out in unemployment insurance benefits in the last month. That being said, I know that there are still too many people who have applied for benefits and who are waiting for their applications to be approved. Earlier this week, I made the decision to expedite those determinations on nearly 20,000 pending claims. These claims would normally require a fact-finding interview. This is not an action that I would normally take to waive that step, but we are not in normal times. Due to the surge of claims during this pandemic, these interviews would have stretched out for months. This is unacceptable. Our goal was to ensure that all those who were likely eligible for benefits could receive them quickly. Every decision was based on an analysis of the claim's likely outcome. This means that about 5,000 claims will be approved. Also, about 7,000 claims will be denied. The remainder of the claims will have their fact-finding interviews expedited to resolve their claims as quickly as possible. Many people will begin receiving information about those decisions today or tomorrow. If your claim is held pending an interview, you will receive an email asking you to check your online account for information. Those who have claims that have been denied will also receive a letter in the mail explaining the decision and outlining the next steps. People whose claim is still being held after this action will be contacted with the date and time for interview if necessary. I should note that these decisions are still subject to an appeals process. Unemployment claims involve two parties, the person applying for benefits and the employer for which that person worked. Either party can file an appeal of the decision, and the information on how to file an appeal will be provided to both parties. I believe that many who will receive a denial will be eligible for the Pandemic Unemployment Assistance Program. This is the federal program that was also enacted by Congress to provide benefits to those who are not normally eligible for state unemployment insurance benefits. The Pandemic Unemployment Insurance Program will include people who are self-employed and people who didn't earn enough in the last 5 calendar quarters to qualify for state benefits. It will also include those with a variety of issues that impacted their initial application. Pandemic unemployment assistance is a new federal program. It is complex. Because it is intended for people who don't normally qualify for state unemployment benefits, we cannot simply tweak our existing unemployment insurance program. All states are working hard to establish new systems to deliver this benefit. Only about 10 states are actually paying claims under this program currently. The federal legislation provided the general parameters for the program, and the U.S. Department of Labor has been working to provide the rules that will fill in some of the detail. We received the initial release of rules on April 5th, and we expect a second release early next week. In the meantime, we've moved forward to develop a new web-based system for these claims based on what we know and made some decisions to fill in other details. The final rules we receive next week should provide the last pieces of information and allow us to complete this important work. I will announce a timeline early next week for our rollout of the Pandemic Unemployment Assistance Program. Now, before I take your questions, I wanted to thank my team at the department. Our unemployment insurance staff are working nights and weekends to clear up application holds, to streamline processes, and to get benefits flowing. Our Career Center staff have received additional training, and many are working to help answer the Unemployment 800 number. Others across the department and across state government are helping to answer questions from callers, data entering information that is still coming in on paper in some cases. It truly has been an all hands on deck, and I am grateful for the professionalism and dedication and public service demonstrated by all state employees during this incredibly challenging time. Thank you, and I'm happy to answer any questions.
Great. Thank you, Commissioner Fortman. We will turn now to our colleagues in the media, and today's first question goes to Megan from WMTW. Go ahead, Megan.
Thank you both. I kind of have two questions, if we could get to them. First for you, Dr. Shah. My question is about plasma. So on both a national level and a local level, we've heard that plasma is part of how patients with COVID-19 are being treated. Can you maybe speak to its efficacy and whether or not plasma donations are needed to help COVID patients? And maybe also we could have Commissioner Fortman weigh in and you, Dr. Shah, weigh in on the protests that continue about reopening the state and what your advice to those protesters would be.
Sure. So Megan's first question is around the use of plasma. For many, many years, going back decades now, the scientific community has known that the plasma of individuals who have gotten an infection and have recovered could be used in the treatment for individuals who are currently grappling with the disease. It's a so-called convalescent plasma idea, and it's been around for quite some time. It's actually the basis of a lot of modern medical therapies, including vaccines. That process right now is being investigated with proper clinical trials. But the FDA has allowed it to move forward on a compassionate use basis, or the equivalent of, because of the pressing need to find therapies for individuals. One of the basic needs or requirements for that to move forward is the plasma itself. One of the reasons that we track recovered individuals and talk and work with recovered individuals is so that if they and their doctor believe that donating plasma is something that they'd like to do, they will know that they are officially recovered from Maine CDC. Whether any one individual who has recovered should donate plasma is really a decision between them and their healthcare provider. There are different criteria and there are different ways of going about it. So we don't have a blanket rule on whether any individual has recovered should donate plasma. We want to make sure that they know that they have recovered so that they can talk to their healthcare provider about it. In terms of your latter question, Megan, I think my advice to anybody out there remains the same, which is if you're outside and you're going to be in a group of people, try to wear a face covering and make sure you take care of yourself and stay safe.
And I don't know that I have anything to add to that, but thank you.
Great. We'll turn next to Brad Rogers at WGME. Go ahead, Brad.
Hi, I've got a question for you. First, Commissioner Fortman, when will self-employed workers and independent contractors specifically be able to file for unemployment and get benefits? And why has Maine not implemented the program when other states have? And I know you sort of touched on this, but if you'd be a little more specific.
Sure.
Could you repeat the question?
Oh, sure. So the question is, when will a specific timeline be announced for the pandemic unemployment assistance program that covers self-employed, and why hasn't Maine started accepting applications even though other states have? Is that accurate?
Yes, that's accurate. Yes,
okay.
Go ahead.
So to the first part, we will be announcing early next week when we will start accepting applications. And I do want to point out that there's a difference between accepting applications and providing benefits. One of the things that we have done, I mean, there are a number of people who are self-employed who have submitted applications at this point. They will be part of the group that will be probably receiving denials from us in the next day or so. The current structure does not permit people who are self-employed to collect state unemployment insurance benefits. What some states are doing is they're requiring people to go through that first step of applying and being denied before actually applying for the pandemic unemployment assistance program. We are going to skip that step. So hopefully our ability to pay benefits will look pretty similar to the vast majority of states across the country.
Great.
All right, thanks. And Dr. Shah, a new study of hospitalized coronavirus patients in New York has found nearly all of them had a major chronic health condition, and 88% of them had at least two. Is that the case in Maine with the hospitalized patients that you've seen, and with those who passed away as well?
So Brad's second question is around data that are emerging about the role of having a pre-existing or chronic health condition and whether that predisposes folks to hospitalization or even passing away. And the answer, Brad, is that it does. What we've seen in data across the country as well as in Maine is that individuals who come into any illness, whether it's COVID-19, the flu, pneumonia, any type of illness, the less healthy that you come into it, the harder it is for your body to come out healthy on the other side. And that's a pattern that we've seen and observed to be holding true for COVID-19. What has been interesting about COVID-19, among other things, is that early on, the thought was that perhaps it was only people with respiratory illnesses who might suffer worse outcomes. But what we've seen from the study that you referenced, Brad, as well as other data from the US CDC, is that it's a variety of health conditions, whether it's kidney disease, heart disease, or having a lung condition, all of which can predispose somebody to not faring so well with COVID-19. And that's a finding that unfortunately also affects individuals who are in minority groups even harder. So we're aware of those data, Brad, and they definitely raise concerns. I'd like to turn next to, you bet.
Are you seeing that in Maine, though? Are you seeing the same things happen?
We are. We're seeing it not just in Maine, but the trends that we've seen in Maine are consistent with what we've seen in other parts of the country. I'd like to turn next to Steve Missler at Maine Public. Go ahead, Steve.
Thank you. I have a question for you, Dr. Shah, but I'm going to lead with Commissioner Fortman, if you don't mind. Commissioner, I know you said that other states have had some difficulty implementing the claim system for gig or self-employed people, but there are states that have seemed to be able to figure it out. How come Maine isn't? Can you just be specific about the challenges that Maine has faced in trying to get the system up and running?
I don't think that Maine has any challenges that are different than other states. Steve, oh, I'm sorry, I'm supposed to repeat the question. The question is, other states have rolled out these the pandemic unemployment insurance. Why hasn't Maine been able to do it? Other states have figured out how to do this for gig workers and self-employed. And I don't think that we have any particular challenges that other states are not facing. And in fact, in some ways, our infrastructure is more stable than some other states. And some of my colleagues are struggling with finding COBOL programmers and dealing with legacy unemployment insurance systems. The good news is we do not have that. It's hard for me to comment on exactly what other states are doing because it varies all over. Some states are taking a very phased approach at how they're doing this and only providing benefits to one segment of people who may be eligible. Our goal here is to make sure that when we roll this benefit out, that it is taking into consideration all of the people who are eligible for it, and that we are accurately providing benefits up front so that we do not have to rework the system as we move along. I believe strongly that our approach will deliver accurate benefits in a timely manner and be fiscally adhere to the integrity responsibilities that we have as a state.
And Dr. Shah, I guess my question for you is that it's related to nursing homes or long-term care facilities. As you know, Maine was pretty quick to implement elevate testing at nursing homes to Tier 1 priority, while other states were a little bit slow to do that. But it doesn't seem to be helping with the fatality rate, which a report from Kaiser Health and your own data suggests is Maine is among, I don't know, maybe a half dozen states or so where 50% of their or more of their deaths are in nursing homes. What does that tell you about the measures that the state has taken so far? Is there anything to be learned from it? And if so, what should we do going forward? Or are we talking about instances where this may not have been prevented because there may have been other factors at play?
Sure. So Steve's question is about the relationship between testing and fatalities, specifically within nursing homes. And Steve, just to recap the numbers, there are 25 individuals who have passed away who are residents of long-term care or assisted living facilities, actually just long-term care, and out of a total of 47. So that's a high percentage. And we certainly recognize that. On one hand, it's a percentage that we anticipated because we knew that we were among the first states, as you noted, to elevate testing in our tiered approach to make sure we put a focus on long-term care. We were one of the first states to do that. We were also one of the first states to move forward with offering universal testing anytime we detected an outbreak, something that other states are now doing. As a result of that, patients who might have otherwise passed away are now passing away and being classified as COVID-19. So that does affect the numbers. However, we also know that nursing homes, based on not just Maine data, but nationwide data, nursing homes can be a hotbed for COVID-19 transmission. We've had really robust conversations with the nursing home community about what they need and then what we need to do to help them get that. There's more coming on that, Steve. But what I will say is that right now, probably our primary area of focus from an outbreak prevention and intervention standpoint is along nursing homes. We're learning some more based on some papers that have just come out, primarily of Washington State. Happy to get those to you about congregate care, some of them in homeless facility shelters, others in elsewhere. We're learning a bit more, but I think it's also highlighting the challenges of preventing transmission once it's been introduced into a facility. So tough question. I know where you're coming from, Steve. We are working on trying to put up additional policies as well as additional services. So I'm hoping to be able to have more to talk about there soon. I'd like to turn next to Ashley Blackford at WAGM. Go ahead, Ashley.
Thank you, Dr. Shah. This question is for you. When it comes to what is the timeline after a hospital identifies a positive COVID-19 case for that to be reflected in the CDC's numbers?
Got it. So Ashley's question is about what happens after a hospital identifies a positive COVID-19 case in order for that to show up in our numbers. And Ashley, I'm going to clarify your question a bit, and if it's not what you're going for, you let me know. I think what you're asking about is not so much hospitalizations, but just generally how do numbers appear? Or are you specifically asking about hospitalized patients?
Yeah, I'd say how the numbers, if they get a hospital gets a positive case, is that reflected the next day in those numbers, or is there something that happens as far as your investigation goes until that gets?
Good. So, Ashley, the answer to your question is that hospitals report to us by midnight every night the number of cases that they have who are COVID positive in the ICU, COVID positive not in the ICU, and COVID positive and on a ventilator. So the hospital makes the determination as to whether any individual case is COVID positive or not, because they would have the testing data. And then they report to us each night what their aggregate numbers are. And then we aggregate all of those numbers, and that's what I report out every afternoon. We also touch base with those patients from an outbreak investigation standpoint to do the contact tracing that we've been doing for months now. So that happens in parallel even while the patient is in the hospital. So does that answer your question?
Yes. Yep.
Okay.
Thank you.
You bet. I'd like to turn next to Emily Tadlock from WABI.
Hi, thanks so much, Dr. Shah. This question is actually for Commissioner Fortman. Some people are still experiencing challenges in collecting their unemployment. With all of these new rules that now include self-employed, do you feel your system can handle this influx of new applicants? And will it affect how quickly this new group of people receive their money?
Sure. So the question is, with all of the people who are still experiencing challenges and with this new influx of folks who are going to be applying for the new pandemic unemployment assistance program, do we believe that the system can handle all of this? I really appreciate the question. Let me take the first part. Yes, we do know that people are experiencing challenges, which is why I took the action this week to free up so many of those fact-finding interviews. I agree that it is not okay to have fact findings take place weeks or even months from now. We did a careful review and feel confident in the decisions that we made to expedite those cases, and that process will stay in place through May 30th. And that should help move things along. Again, as I pointed out, it is a two-party system, and there is an appeal process for both the employer and the claimant. In terms of the self-employed, one of the things that we are doing that is a little bit different is we will be working to do outreach to organizations And next week, when we talk about our timeline and our rollout, I can go into greater detail. But one of the things that happened with unemployment insurance is the second week in March, we had under 700 initial claims, and the following week, the week that began March 15th actually, we had over 21,000 claims. There was no way any system could have been prepared for that kind of influx. We have taken a number of steps since then. We have 100 people who are now, we contracted with a call center to handle those phone calls. We have cross-trained our employment services staff to also pick up pieces of that. And we are hiring additional unemployment insurance staff, as well as we've brought back some retirees. But the other thing that we're doing is, one of the things that happened immediately was we started receiving unemployment insurance claims from people who had absolutely no idea what the unemployment insurance process was like. They did not understand how to fill out applications. Many of the frustrating holdups that were happening was because information was put on the forms incorrectly, requiring some sort of intervention by people in unemployment insurance. We are hoping that we will avoid much of that as we roll out the pandemic unemployment insurance program by doing outreach to associations, employer groups, advocacy groups, walking through what we believe will be a much simplified application process for people who are applying for these claims. And also, our goal is to have a kind of behind-the-scenes interface with our Reemploy Me system for folks who may not have met the monetary eligibility under state unemployment, but would meet the eligibility under pandemic unemployment assistance. So could we always use more help? Of course we could, but I think we at least have been ramping up and are much better prepared at this point.
Can I just follow up with that? How quickly do you think this new group of self-employed could see their money? I mean, a lot of them have been out of work just as long as unemployed, and so I'm just wondering how quickly they might be able to see some of these benefits.
Yeah, and I think unfortunately, that's what in order to give you a solid answer, I need to wait until next week to give that to you. But I just want you to know that we are working as quickly as possible to make this happen, and that our goal is that once we roll this out, typically unemployment insurance, it takes 10 days to 2 weeks before someone would be seeing their initial benefits. Our goal is when we roll this out that timeline would be shorter than that.
Thank you, Commissioner.
Thanks, Emily. We'll turn next to Eric Russell at the Press Herald. Go ahead, Eric.
Good afternoon, Dr. Shah. These questions are for you. I got two. You talked a little bit about probable cases, which is a new category that's now in the mix. I wonder if you could tell me a little bit more about how you're tracking probable cases and whether or not there's confusion or will be confusion about probable versus confirmed. And then the second question was about backlog of tests. I know a couple of weeks ago that was a major issue, but it's been talked about less. So is there still a backlog? Is that an issue?
Great. So Eric's first question is about this new category of probable cases. And Eric, this is pursuant to a decision that was made by all 50 states' state epidemiologists and their professional organization. They hammered out this definition of how someone could be considered probable. Right now, of our 965 cases, only 2 are probable. The way that someone most classically might become a probable case is, for example, someone goes to the doctor, they're not feeling well, and it turns out that they are found to have COVID-19. Our disease detectives are notified. We call that person and begin our contact tracing, which is what we do for every positive case. As part of the contact tracing exercise, we instruct the probable case to let us know about everyone that they come into close contact with. And they might say, okay, yeah, I've got a spouse and we've got 2 kids. we will then reach out to or make sure that the spouse and the children are given instructions about what kind of symptoms to be on the lookout for. If they develop them, they're instructed to go to their doctor and say, hey, Maine CDC told me that I'm a close contact of a confirmed case, and here's what you need to know. Their doctor may decide not to test the person because the timeline of when they develop the symptoms, as well as the symptoms that they've got, are classic for COVID-19. And their doctor may say, you know what, you're feeling okay, don't even bother coming in, just stay home. And their doctor would then notify Maine CDC that they've got a probable case. No lab test, but in this case, it looks like a case, behaves like a case, it's got all the symptoms of a case. We label it as a case even though they don't have a lab test. They might decide in a couple days to go get a lab test, in which case they flip from probable to confirmed. We're not sure, we hope this doesn't cause confusion, and I will definitely try to be clear and answer as many questions as folks have. But as you can see right now, the number of probable cases is just over 2% of our confirmed cases. But Eric, in the interest of thinking ahead, because we now have this new category and other states are rolling it out, there will be more cases. There will be folks who previously weren't counted, as we've talked about in these meetings, but now will be. So we do anticipate seeing more cases, but they'll be in this probable definition. The second question you raised is about any backlog in testing. Right now at the Maine CDC laboratory, there is no backlog, and there has not been a backlog for several weeks now. We'll get you the exact date as to when that backlog was cleared out, but I want to say it was maybe about 3 weeks ago, Eric, maybe even a bit longer. So we'll get you the exact date, but since that time, tests come in, tests are run, results are reported out, and there is no backlog. And if you've got more questions on that probable business, you let us know and we'll get you answers. I would like to turn next to Dan Newman from the Maine Beacon. Go ahead, Dan.
Hi, thank you. My question is for Commissioner Fortman. There have been calls from many workers and labor groups to speed up implementation of the state's paid time off rule, and the Maine Chamber of Commerce has pushed back on this idea. Is this being considered, and have you had any requests from business groups to delay the current public comment or implementation schedule?
We have. Okay, so the question is about Maine's paid time off rule. This was legislation that was passed a year ago. The implementation date is January 1, 2021. We held a series of listening sessions across the state all fall to gather information before we posted our draft rules. The draft rules were posted, and we had we're still in the comment period at this point in time. We extended, we held a public hearing virtually, practicing appropriate social distancing. It was a new experience for us, but we did hold a public hearing about a week ago, and we received a letter from business organizations requesting that we postpone the hearing. We did not postpone the hearing, but we did extend the comment period. And I'm trying to remember off the top of my head, it's sometime until, I want to say May 27th, but I can get an exact date for you.
Great. Thanks, Dan. We'll turn next to Joe from ABC 7. Go ahead, Joe.
Hey, Dr. Shah, this question's for you. The U.S. CDC director talked a couple days ago of a possible, looking into the future, of a second wave with the flu and the coronavirus creating more of an issue. I was wondering if you could elaborate on any sort of testing that the CDC is conducting to learn more about the virus and how it spreads and everything else. And along with that, what is your top priority for an unknown variable?
An unknown there? Is that what you said?
An unknown variable.
Unknown variable. Okay, an unknown there. I thought you said an unknown bear, because I don't have thoughts on unknown bears. So Joe's question is around recent comments that CDC Director Dr. Robert Redfield made about the possibility of a second spike of cases that could come in the winter, and the testing, the intersection with that and testing. So Joe, let me say two things. The first is there is the possibility of a second spike occurring at any time, whether that's in the winter or perhaps in the summer. And what will determine that is, in part, the way in which we contend and control the virus now. We can't really predict what the virus will do, but what we can predict is our response to it. And the stronger and more robust our response is now, the more physical distancing we impose now, the less likelihood of a secondary spike at some point in the summer. That doesn't exclude the possibility of a spike in the winter. And so for that, Joe, your second question, or your related question, is around testing. One of the approaches that we are going to be taking, I don't know when, but it's under discussion and planning right now, is to launch what is a so-called Sentinel testing system. Sentinel testing is a system whereby we will offer and ask certain people who come to their doctor's office, maybe for allergies or maybe for a twisted ankle, on a random but predictable basis. We will ask them if they would be willing to take a quick test for COVID, and thus get a better handle on what's going out there. We do this and are planning to do this because of two reasons. One, Joe, is the reason you noted, which is if there starts to be a spike, we want to try to get ahead of that before people start showing up at the hospital. We'd rather get ahead of it when they're just going to their doctor's offices rather than when they're waiting to go to the ER. The second reason we're planning around a system like this Sentinel detection system, is because we also know a high percentage of people with COVID don't have any symptoms at all, but can still transmit it. So again, we'd like to get a better handle on what's going on out there. And by using this so-called Sentinel detection or Sentinel diagnosis approach, we'll be able to work with healthcare providers and try to get a better handle on what's going on. That process is still a ways away. We're still in the planning phases, so I don't know when that's going to launch, but it is part of our long-term strategy around managing COVID. I'd like to turn next to Jessica Piper at the BDN. Go ahead, Jessica.
Hi, Dr. Shah. Thanks so much. I have a couple questions for Commissioner Fortman. First off, on the fact-finding interviews, we've heard of people who had interviews scheduled as far out as July. I'm curious, with the changes you announced today, how many people are still going to require those interviews and what the timeline might be for that?
Sure. So Jessica's question is, she's heard about people who had timelines for fact-finding interviews scheduled out to July, and how is that going to impact the people that we made a decision about today? So roughly, we looked at about 19,000 people who were would have normally been scheduled for fact-finding. And it was exactly what you pointed out, Jessica, that made me decide that that was not a timeline that was appropriate. If we took the normal course of business, we would be scheduling out until July, and that is just too long for anyone to wait. So about 12,000 people have been, we've had that expedited. They will not have fact-finding. They will be receiving the notices by email and in U.S. postal mail in the next couple of days. I believe the email either went out today or earlier today, or it will be going out later this evening. And then the remaining folks, we're also either looking at scheduling fact-finding if we must have that two-party process. We're also looking at other ways to expedite those cases by doing paper reviews. So I would say it should have a significant impact on all of the folks who were in those categories, Jessica.
I'm trying to do the math in my head. Would that be like 7,000 people who still need the fact-finding interviews or something else?
Right. I think that that's accurate. The other thing that we're doing is we're extending this process through May 30th. So if new claims fall into those categories, that will be the process that we'll be using until May 30th. So those numbers should not be building up.
Okay, and then on the pandemic unemployment assistance, could you say a little bit more about sort of like what specific guidance Maine is waiting on? Like what do we still need to learn?
Well, Sure. And some of the things are the way that the law is written. Again, these are people who are not traditionally covered by unemployment insurance. Unemployment insurance, but the new programs need to work in tandem with the existing unemployment insurance. So the structure, the framework of unemployment insurance is you have to have lost your job through no fault of your own. You must be able to work, available to work, and looking for work. So the Pandemic Unemployment Assistance Program is now going to cover self-employed people. How do we determine if they are able to work, available to work, and willing to work? We need some guidance around that, or some additional clarification, because we're also being told, get this program up as quickly as possible, and at the same time, you will be held to rigorous auditing and program integrity standards by the U.S. Department of Labor. In the entire time, and I've been in and around Department of Labor programs since probably the early 2000s, and I have never received a letter from the Office of the Inspector General before a program was up and running, reminding the states of their responsibility to make sure that money goes out quickly, but it only goes out to people who are actually eligible for it. So we are doing everything that we can to meet those dual goals and get benefits out as quickly and as accurately as possible.
Great. Thanks, Jessica. We'll turn now to Amy Brown at WERU. Go ahead, Amy.
Thank you, Dr. Shah. As I'm sure you're very aware, the governor's stay-at-home order expires in less than a week now. What would your advice be? Could you say what you would say or what you have been saying to the governor about extending that, or whether you think we can safely start reopening in a week?
So Amy's question is specifically about the governor's stay-at-home order, and it's and the fact that it expires at the end of the month. How should we think about that? How should we look at that? And Amy, what I've talked about with the team here as well as with the governor is that we really do need to make these decisions looking at the data, which are quickly evolving on a day-by-day basis. Earlier this week, we had a day where we only had 8 cases. And then we had days where we had double digits and multiple individuals who passed away. It's really emblematic of how quickly this outbreak and any outbreak can change. And so thinking about what might be a particular policy position that would or would not be enacted even 7 days from now, even though that's not a lot of time, is really challenging. My goal and my view is that we take a look at the data as they come in. There is no necessity for making a decision today about what we might do a week from now. And so we're looking at the data all the time on a constant basis, and I'm in close contact with the Commissioner's office and the Governor's office as we're spotting trends and as we're seeing changes. And that's the basis upon which any decision, be it about the stay-at-home order or any other type of policy, it's upon those data that all of these decisions are founded.
Okay, thank you. And regarding contact tracing, we've had a couple of questions from listeners. One, wanting to know if businesses are being notified if someone who tests positive has been in their business in recent days. And another wondering if people should start keeping kind of an informal journal of where they've been and who they've been in contact with, just in case they test positive, if that would be helpful for your contact tracers. Sure.
So Amy's questions are about the nuances of contact tracing. Contact tracing is a fundamental part of what our disease detectives do on a daily basis. Other states there's been a lot about it in the news. And I want to just take a moment, Amy, to just reemphasize for everybody that although a lot of other states are talking about doing contact tracing, it's something that Maine CDC and other state health departments are already doing. We are, of course, beefing up those efforts now because of the increase of COVID-19, but it's not a new venture. So it's just an expanded one as opposed to a new one. Amy, you raised two specific questions. One is whether a particular business would be notified if someone who tests positive were there. And it really depends on the length for which they were in that store or business establishment. If they were there for a 4-hour banquet, then they would definitely be notified. Of course, a lot of those things aren't happening now. But if it was just someone who may have popped in for 5 seconds to just take a look at something, they may not have reported it to us because they may not have even remembered they were in the store. The extent to which we are able to notify others that of someone's movements who has tested positive depends almost entirely on what that person is able to remember and recollect. So if they tell us that they spent 45 minutes in a store at a department store buying supplies, then yes, we notify the store. If they don't remember it because it was so fleeting, we're not able to do so. Which leads to your second question about whether everyone right now should be keeping track of their movements and in the possibility that they might get COVID-19 and need to have that. I can't give any specific advice about how anyone should be keeping a diary of where they've been and who they've talked to. I can say that if someone did have that, it would certainly be useful to us. But it's not the only means by which we're able to reconstruct. We go back 16 days after someone is tested positive. 16 days. I don't know about you, but I can't remember who I spoke to last night, let alone who I might have bumped into 16 days ago. So we use a variety of different tools to try to get at that. We ask people to go back through their social media accounts and maybe look at where they posted things on Instagram. We ask people to grab their credit card receipts to see where they may have visited. We use a number of different tools to try to jog people's memories to try to get a better picture of their last 16 days. But as you can imagine, it's pretty challenging. We do the best we can. If folks do have a diary of everywhere they've been, it would certainly be helpful, but it's not something I'm going to recommend because I recognize how difficult it is. I'd like to turn next to Michael Fern at the Maine Edge.
Thank you, Dr. Shah. I have a few questions, but two are real short. To follow up Amy's question, you said yesterday that we're about halfway through this. The University of Texas Austin model reported earlier this week indicated that our peak is 2 weeks out due to the impact of social distancing, while the IMHC model says restrictions may start to be relaxed around May 13 with containment strategies. Do you agree with that, or are you relying on a different model? And if so, can you estimate when the peak will be? Because it seems like we have two ongoing curves here. We kind of have a curve of the general public, while we also have a curve that's happening in the long-term care settings. And my second question is, could you give us an update on the total infections for healthcare workers?
Sure.
Thanks.
Let me start, Michael, with just being really clear. In your question, you indicated that I had noted that I thought we were about halfway through. If I gave you that impression, or if I've given anyone that impression, that is not the case. Although I have a good sense of where we are right now, it is difficult in any outbreak situation to predict where we might be going. One of the things that we know about outbreaks is that they are almost by definition unpredictable. And so, Michael, I just wanted to be really straight. If I gave you or anyone the impression that I have a sense of what percentage of the way through we are, I'm not sure. What I know for sure is that we are still in the thick of things. How much further we may have to go, it's difficult to know. What I will say in connection with that is that there are a lot of folks out there who are making predictions about when this will be over. And one of the things that I've learned in my life is that zealots and charlatans are sure, but wise people have doubts. And so in this situation, I've got doubts. What we know about outbreaks is that predicting when the peak may happen is very difficult to do. We don't use models to project or predict when we might be at the peak. We use them to plan for our response depending on what that peak might be. So we use models to generate all different types of scenarios, from the best case scenarios to the worst case scenarios. And then we look at those worst case scenarios and make sure that no matter how unlikely they may be, we've got a plan in place to be deployed if that scenario were to materialize. So we use a bunch of different models, and when one model predicts that we might be at a peak versus when another model predicts we might be at a peak, doesn't really affect our day-to-day. Because the other thing I know about outbreaks is that we only really know that we've been at the peak when we look back on it. And that's the case with flu outbreaks, it's the case with measles outbreaks, it's the case with foodborne outbreaks. It's only in retrospect are we able to say that was the date that we hit our peak. And we almost never know that during the outbreak itself. So just wanted to be really clear with that, Michael. And then your second question was around healthcare workers, and there are 238 healthcare workers in Maine right now who have tested COVID positive.
Sure. Can I ask a quick follow-up?
You bet.
Have you designated any other county as a transmission county, or is it still just the 4?
Michael's follow-up question is about other counties where community transmission have been noted. And Michael, at this time, it's just the 4. No new counties.
Thank you.
And the last question of the afternoon goes to Mr. Don Kerrigan. Don, go ahead.
Thank you very much, Dr. Shah and Commissioner Fortman. I have a question. One question for Dr. Shah, and then a question that's really for both of you. For Dr. Shah, regarding the answer a few minutes ago about what you will advise the governor on extending the stay-at-home order, what could really change over the next 6 days that would tell you, oh, everything's under control, we don't need to keep the stay-at-home order? We had double-digit more cases today, and we've had increases every day. What could change possibly in 6 days that would say we don't need it anymore? The other question is about manufacturers, workplaces, and enforcement of all the various rules for what should be happening, social distancing, etc. Who from the state, is anyone from the state, CDC, state OSHA, Department of Labor, anyone from the state or the federal government, if you know, going into these workplaces and checking to see if these rules are actually being followed?
So, Don, the question, I'll try to answer the last question first, which was, is anyone from the state actually going into the businesses and enforcing any of the standards that people are suggesting, or any of the rules that have been put in place around social distancing, and who's paying attention to that? And you asked if anyone at the state. The Maine Department of Labor is only has authority over public sector. We do not have authority over private sector employers. That is state OSHA. U.S. OSHA. There is a tip line, and we work closely with U.S. Department of Labor, OSHA, and so we would share information. I'm not sure if they are out and actually doing investigations at this point in time. They have issued guidance on a regular basis, and that guidance is posted on the Maine Department of Labor website. I believe it may also be on the governor's COVID-19 website as well.
And Donna, your first question, you skillfully asked me to, or invite me to speculate on what might happen in the next week that could change. And Don, as you know, it's difficult to speculate, especially in the setting of a rapidly changing outbreak. Very difficult. What I can say is that the trends that we've seen right now are ones that we're keeping track of. We're daily, multiple times per day, trying to get a better sense and a deeper understanding of who in Maine is being affected by COVID-19, how they're being affected, and what additional public health interventions, if any, we can put into place to slow the transmission, to try to flatten that curve. It's difficult to predict what might change between now and even 24 hours from now, let alone a week from now. What I can assure everybody is that the entire team of public health professionals at Maine CDC is working 24/7 on this. Whether it's our people who are on call to take consults from physicians in the middle of the night, the folks at our call center who are picking up the phone and fielding questions, the folks at 211 who are asking and are answering questions from everyone who's watching right now. Every single person at Maine CDC is focused on and invested in getting a better handle on the situation, taking every measure we can to keep people safe, and providing the best possible advice we can to each and every policymaker out there, be that the governor, the legislator, business leaders, and other stakeholders out there. That is our singular focus, and I assure everyone and pledge to everyone that we will continue to do so, keeping in mind our three core values: common humanity, transparency, and a commitment to science and data. So with that, I'd like to thank everyone for joining. Commissioner Fortman, thank you for joining today. As we go into the weekend, I'd like to remind and ask everyone, as always, to be kind, to be safe, and take some time this weekend to take care. Thank you very much, everyone. We'll talk next week.